Today, we're shining a spotlight on a hidden danger that could literally be sitting in your living room right now. We're talking about something small, super colorful, and, well, completely harmless looking. But knowing how to spot and manage this hazard, it can absolutely save a child's life.
So, could a tiny, colorful little toy actually be deadly? I know, it's a terrifying thought. As parents and caregivers, we're always on the lookout for sharp edges or obvious choking hazards, but there's this deceptive threat just hiding in plain sight. These things look like fun little candies or harmless craft supplies, but once they're swallowed, they trigger a massive, high-stakes medical emergency.
So, what exactly are they? Well, we're talking about superabsorbents, often called hydrogel beads. Basically, these are polymers specifically engineered to soak up and hold hundreds of times their own weight in water. They turn into this massive, solid gel. You've probably seen them around. Think water beads, Orbeez, those little plant soil crystals, or even the absorbent gel tucked inside everyday baby diapers. Now, outside the body, these beads are chemically non-toxic. They're tiny, they look totally innocent, but inside the human body, totally different story. You see, they don't poison you. Instead, they cause severe mechanical complications. Because they're literally designed to hunt for liquid, they kick off this explosive swelling process the absolute second they hit the stomach. Let's break down exactly what happens in the gut. First, the bead starts pulling water directly from the surrounding body tissues and fluids. Second, it swells to many, many times its original size. And third, all that massive expansion causes a physical blockage, a severe intestinal obstruction, or even ischemia, which is a really dangerous drop in blood flow to the organs. And as my medical guidelines point out, the risk shoots way up depending on how many were swallowed and, crucially, how long it takes to diagnose. Section 1. Recognizing the symptoms, a ticking clock. Here's the really scary part I'm always warned about. At first, a child might show absolutely zero signs, nothing. Within the first few hours, you might just notice some mild abdominal pain, a little vomiting, or maybe they're just irritable and don't want to eat. But as those hours turn into days, things deteriorate rapidly. We're talking severe pain, serious dehydration, constipation, and eventually visible signs of shock. These symptoms escalate incredibly fast because the complications happening inside are, frankly, terrifying. We're looking at intestinal obstruction, ischemia, and even perforation, meaning the bead literally tears a hole right through the intestine. That leads to peritonitis, sepsis, and shock. And these life-threatening complications, they can happen within just hours to days of a child swallowing one of these. Section 2. Emergency pre-hospital management. So what do you do if you suspect a child swallowed one? First, stay calm. Take a breath and assess the situation. Try to note the exact time and roughly how many beads were swallowed. And this is absolutely critical for us in the ER. Bring a sample bead, a photo of it, or the original packaging with you to the hospital. Most importantly, seek immediate emergency help. Just monitor the child on the way there, but get moving. Just as importantly, here's what you absolutely must not do. Do not try to make the child throw up. Don't give them food, milk, or any laxatives. Please do not try to forcibly dig anything out of their mouth with your fingers. And whatever you do, do not delay. Waiting around to just see if it passes can literally be a fatal mistake. Section 3. At hospital medical treatment. Once you arrive at the hospital, the medical steps are immediate and intense. We'll take a detailed history, run abdominal x-rays to hunt for blockages, and get IV fluids going to correct the dehydration. But here is the stark, hard truth. There is no magic antidote for this. The management is purely supportive. If we see signs of obstruction or perforation, an urgent surgical consultation is required to go in and manually remove that blockage. Section 4. Prevention. Keep children safe. Because the treatment is so incredibly invasive, prevention really is non-negotiable, especially if you've got highly curious kids under 5 running around. Keep all these superabsorbent products completely out of reach. We're talking high shelves in secure, closed containers. Honestly, just don't allow children to play with water beads or gel crystals at all. Dispose of things like torn diapers safely. And please make sure to educate everyone, your babysitters, teachers, grandparents, the whole shebang. Which brings us to the biggest takeaway from our explainer today. As I always stress in my own practice, early recognition and timely referral are crucial. Prevention is the best protection. The risk of severe, life-altering complications goes up with literally every passing minute of delay. Immediate medical action is the only safe path forward.
So I want to leave you with one final urgent question.